No fundo, minuto ou minuto e meio, para dar
Well,
as
1.5 minutes just to welcome all the participants
seja em formato presencial, seja
that are in presence, and mostly you are at distance. And so I want to welcome you to this conference on food supplements. We have different approaches and different perspectives. As General Director, I want to just present a vision from the acquisitive point of view, in the sense that what we take from this operational dynamic, it's just a number. We should just know that in the RASH, in the European network on food materials, 29% of the expenses have been on food supplements. And as a consequence, this crosses different aspects, from touching the consumer, health areas, the food area, of course, with the competent authority. But this effort of an added value of the acquisition that we had in the inspection, we can increase with the support of ASAE, with the moderator, also the director of the scientific committee that is going to be the moderator of this debate, so we can have this meeting of PPEU 21. So thank you, Mr. Minister, State Secretary, and I will give the floor to the Minister of the Economy and Digital Transition. Thank you. Thank you, General Inspector. Good afternoon, everyone. Not only those that are here in this small room, but I salute everyone that is in distance with us in this model. I'm very pleased to be able to participate in the opening session that is promoted by our Authority for Food and Economic Safety, ASAE, and it's inserted in a theme that it's more and more important from the economic point of view, as well as from the point of view of awareness to the new habits of eating and consumption of European citizens. So I congratulate ASAE, the Authority for Food and Economic Safety, for choosing this theme for discussion in this forum of food supplements. The COVID-19 pandemic that we've been living made a lot of changes, and it has had important impacts to the way our economies and societies work. The level of food safety and the strengthening of our food chain supply. In Europe, we've been testing our logistics systems, our production and distribution and commercialization of the products, so they can make our products to attain the consumer to ensure that it is crossed in the protection of the consumer, and namely the decision, the informed decision of the consumer. This is exactly in this area of the food supplements and food safety. That is very important. This theme is also important having into account the impact at economical level. This market of food supplements represents more than 100,000 million euros in the EU. And in Portugal, we know that more than 1/4 of the population over 15 years old consumes regularly food supplements in different aspects and forms. The importance in terms of employment, commercial structures is also important for choosing this theme, the ASAE choosing this theme, the Authority for Food and Economic Safety. So having into account the particular aspects of this theme, arises specific questions about the way it is commercialized or advertised, that these products are commercialized and advertised, and the authorities to that do the fiscalization of these, they have to be sure that safeguard the products that are available to the public in all the internal markets. So that demands also sharing of information between the authorities of the different member states, but it's also important that the information that is available, it's truth, the information about these products. Many of these products are in the border between what it is a drug and a food supplement or with food. So the category where we integrate each one of these products is very important so that we know what are the rules that we are going to apply. This is essential. And we see in an area with so much innovation, these themes is very important. Providing clear information to the consumers, namely in what concerns the digital commerce, is also related with another aspect important to our presidency. It's the new consumer agenda, where the importance of an informed decision, the availability of information so that the consumers can exactly know how their decision, their consumption decision, is framed within the rules that are applied, it is essential. So, we are in a growing market, in a very sensitive sector, in an area with a lot of innovation, and in such a critical situation for the functioning of our internal market. We can understand this theme is very important to be discussed within the Union and within the deepening of the development of the internal market. So I would like again to salute the Authority of Food and Economic Safety, ASAE. And I want to share with all those that are participating in the conference, I want to say that authority like ASAE, it is very important in order to ensure the safety of the consumption, the food safety, the quality of the food that in our country, in our days, has very high levels and have very high standards. We still have the National Council of Food Safety, which is under the Minister of Agriculture, that is going to be the closing remarks for this conference. So all these steps are very important in order to ensure something that should make us all proud, the possibility to offer to the European consumers levels of quality and safety at food level that were never seen previously in the history of humankind. And I want to speak about the ASAE role, and I imagine the roles of other authorities in other member states that have similar functions, because during the 15 years that ASAE is functioning in this standard, has helped enormously to increase the quality of our offer in the food domain, also to ensure the confidence of consumers in the products that are made available to the public, and also to disseminate better practices coming from control and fiscalization evolving into another area of disseminating best practices with economic operators. So, ladies and gentlemen, I want to wish you all a very good work in our discussion today. As I mentioned, it is essential for the well-functioning of our internal market, and for that reason, the European presidency can obviously be involved in the reinforcement of connections between the member states and between the authorities of the member states. It's a very deep and critical work, but it's worth it, undoubtedly. Thank you so much.
Portugal assume a presidência do Conselho da União Europeia durante o primeiro semestre de 2021. É a oportunidade para promover uma agenda atual para a União Europeia, indo ao encontro dos cidadãos europeus, das suas ambições, dos seus interesses e assuntos, dos desafios globais que têm impacto nas suas vidas. É um reencontro dos Estados-membros numa altura de extrema importância para a coesão e solidariedade da equipa europeia em torno dos seus valores, metas e objetivos de crescimento. As transformações que se fazem sentir em todo o mundo e nos afetam a todos merecem da União Europeia respostas sustentáveis, responsáveis, globais. A presidência portuguesa vai destacar a forma global e integrada com que a União Europeia responde aos grandes desafios da modernidade. A Europa social, a transformação digital, as preocupações ambientais, a abertura a outras regiões do mundo. A resiliência da Europa assenta na solidez das suas respostas e modelos de desenvolvimento, que colocam os cidadãos no centro do projeto europeu e que contam com a coesão e solidariedade das suas comunidades para superar as adversidades, nunca deixando ninguém para trás. Portugal assume a presidência do Conselho da União Europeia com a naturalidade da sua liderança, no diálogo com outras regiões do globo e com os seus exemplos de boas práticas nas políticas de desenvolvimento, demonstrando a resiliência do modelo social europeu. Portugal vai projetar uma mensagem de solidariedade e de confiança no futuro, promovendo o país na Europa e no mundo, destacando a sustentabilidade ambiental e social, a globalização responsável, o acesso à tecnologia e à digitalização. A partir do Centro Cultural de Belém, centro operacional da Presidência, as atividades e reuniões vão alargar-se a outras cidades de Portugal e a palcos virtuais por streaming e videoconferência com outros Estados-membros. Uma presidência digital em que a tecnologia e a inovação aproximam a Europa e os cidadãos. Esta visão integrada afirma Portugal como protagonista global aberto ao mundo, que assume o seu papel condutor da União Europeia por ocasião da presidência. Presidência portuguesa do Conselho da União Europeia. Tempo de agir por uma recuperação justa, verde e digital.
Distinguished guests, dear participants, for those watching us now for the live stream channel, please consider the transmission will be interrupted during the next speaker. It will be resumed with the next presentation. We welcome the novel perspective of the regulatory landscape of dietary supplements and herbal medicines. Mr. Valerio Curtui, it's a pleasure to welcome you to this high-level conference. The floor is yours.
Good afternoon, everyone. I hope you can see my slide. Please confirm and you can hear me.
Yes, we can hear you perfectly.
Yes.
Thank you.
Okay, wonderful. Sorry, I was just, because the screens has changed yet. So first of all, I thank you very, very much for inviting EFSA to this conference. And what I'm going to present to you, it's a bit, or at least part of the presentation, not fully related to, or not related to the EFSA activities, but I accepted this topic to discuss about based on the experience we had, and I will explain soon why. So in my presentation, I will touch in the first part on the global perspective of the regulatory landscape of food supplements and herbal medicines. And then I think it's very relevant for the discussion today on the safety of food supplements to also refer to what EFSA is doing to ensure safety of these products. Okay. So what I'm going to talk about the global perspective on the regulatory landscape actually stems from a meeting that we had in 2018 in Beijing. And that meeting was organized by the Global Coalition for Regulatory Science Research. EFSA had participated into that meeting as we have an interest on research and the improvement of research in this area. And what I'm going to present are actually key aspects from that meeting, which have been also published in a paper that me and one of my colleagues and myself have co-authored. So that's why I accepted this talk, because I will be basing actually my view, or the view I expressed on this paper and the discussion that took place in that meeting. Now, in that meeting, the countries who were participating presented their regulatory frameworks and was discussed quite intensively. But the first thing that appeared very relevant and confusing was the terminology that has been used. Everyone had given the definition of their categories but it was not clear whether, for example, the food supplements in the European Union are the same as dietary supplements in the US, whether health food is the same with the natural health products, and so on and so forth. So it was very confusing for many of the participants who were not really into the area. And that's why we decided to have this paper and try to make a bit of sense of this information. So what we have tried, and the participants, the authors of this paper have tried, was to put the different products or groups into two categories. One we called classified as supplements, and the other one classified as medicines. It is a forced grouping. Please do not take it as being absolutely accurate, but just to give an idea of the situation, I think it's very relevant to have this classification. Basically, in the category supplements were put those products which can bear health claims, but cannot bear therapeutic claims. And in the group of medicines, of course, are those who normally have therapeutic claims and are used for treatment of illnesses and prevention of diseases. So what we see in this picture is that almost all countries have these two groups separated in the supplements and in the medicine, with very few exceptions like Australia, and even Canada. It's developing a framework for supplemented foods. But then also when we look to the regulatory bodies for these products, we note that in some countries, both categories are regulated by the same body, like in Canada, for the time being, in the US as well, while in other, sorry, I'm saying wrong, in China, I'm sorry, but by the same authority, yes, and the US, I'm sorry, while in other countries, the two categories are regulated by different bodies, as it is the case in European Union, but also in Japan and New Zealand. So we see these discrepancies between the regulatory bodies which are involved into these two groups. Then we look to the requirements, to some of the requirements for the two categories, and we noted quite some differences in the category supplements. First, they are all allowed to be administered by oral route in all countries that were covered in this paper. Pre-market authorization, it's not required usually, with the exception of the EU when it's about the novel foods, in case an ingredient will be classified as novel food. It's required pre-market authorization by in China, and it's planned probably to be also in Canada. These products can bear nutrition and health claims, but it's very different the context and the framework, sorry, for allowing nutrition and health claims. And as I said, no therapeutic claims are accepted, with very few exceptions for some products in China and in Japan. For the medicine, so those classified as medicine, pre-market approval, yes, it's needed in all these countries. Clinical trial data are used with some exceptions, and also historical usage or traditional use is accepted. And all these countries as well have a system in place for reporting adverse reactions. Now, what is the consequence of these differences between the regulatory requirements and also the type of safety assessment from country to country? First, it was noted that a product could be placed in more than one category. And we have here an example of green tea extract, which can be a supplement and medicine in the US and also in the EU, of course, depending on the dosage, depending on the route of administration and so on. While in other countries, it can be only in one category, either supplement or medicine. There are also differences in dosage and the maximum amounts allowed in the different countries and jurisdictions. And importantly, then manufacturers must comply with the requirements in the respective country. To repeat, most of the differences are observed in the group classified as supplements. However, the main focus in all countries is on safety of consumer, and there is much more consistency among products classified as medicine. Now, what was concluded? It was concluded that there is a lack of harmonization, of global harmonization of the regulatory framework for supplements, and that's mainly due to the lack of global consensus for definition of the different categories and also for characterization of the products. There are different jurisdictions with their own regulatory schemes that were developed, applying various regulatory principles, quality schemes as well. And also important to note that these regulatory schemes were developed over time, and one regulation after the other, filling a gap and another gap and so on, resulting in a quite complex construct in each country or jurisdiction. Cultural factors and tradition is very important in some of the countries and less in another. And then if you add the different approaches in allowing nutrition and health claims, that adds quite some to the complexity of the regulatory framework for supplements. So it was clear that there is need for improvement and harmonization of the regulatory framework. However, it was considered that to try to improve the regulatory framework globally, it's rather a mission impossible. And that's why the meeting was more focused on improvements in the area of safety assessment and how can different countries and the science contribute to improving guidelines and harmonized requirements. And then one of the topics very important that was discussed was how these emerging technologies could contribute to the improvement and harmonization of the requirements for safety assessment for food supplements. If you think, today we are mainly looking for ensuring quality and safety of the products. We are looking into the conventional toxicology methods to standards, monographs and pharmacopoeias and conventional analytics. But there is much more technological possibilities to be used for ensuring a better safety, a better communication to consumer and so on. And in that context was concluded that indeed these emerging technologies might contribute to harmonize and improve the guidance for requirements for the different products. Also to assess complex ingredients, if you think about advanced analytics and in silico methods as well, to ensure better safety and quality of botanicals, either by applying QPS approaches, omics, but also blockchain was mentioned as very important emerging technologies for ensuring the tracking from the origin to the consumer of the products or the different ingredients in the supplement. And of course, that would allow to have a more transparent system for the consumer. Ideally, all this knowledge would be in some centralized databases and available to every stakeholder and expert so that everyone can make full use of them. It looks promising, but of course, this is a lot of work and we have to see as well how the science will progress and how these emerging technologies will be incorporated into the regulatory requirements for safety and quality assurance. So this is about the global perspective, and now I will move to the part on what EFSA is doing in relation to safety of food supplements. And allow me upfront to clarify the role of EFSA as an independent scientific body, as an EU scientific body. So we are providing independent scientific advice in support to the EU risk managers and policymakers. We provide also risk communication and we develop guidance documents for requirements. But we are not involved, and it's not our duty to develop legislations. We are not involved and it's not our task to make regulatory decisions. We are not in charge of classifying substances, authorization, labeling, sanctions, and so on. So all this, it's part of the risk manager's duties and not for EFSA. So that's why I was saying the first part I was talking about, I accepted to talk because of the of my participation, the conference and authoring of the paper, but it's normally not our duty to talk about legislation. What we are doing in the area of food supplements. So We, as I said, provide independent scientific advice, and we provide this advice related to some generic questions that may come, either nutritional assessment or in relation to labeling. But a lot of our work is actually in the area of safety assessment, and I will go in the next minutes through that. And an additional part is the work on efficacy assessment under the health claims regulation. Now, in the group of generic assessment, we have the work on dietary reference values. And these dietary reference values, it's an umbrella term for a set of reference values for nutrients that includes average requirement, a population reference intake, adequate intake, and so on. But importantly, also, it includes the tolerable upper intake level, which are the maximum daily intake of a nutrient from all sources that can be consumed safely over a long period of time. And these upper levels are very relevant for establishing the maximum levels for vitamins, minerals in food supplements. We have produced so far 34 opinions, and they are all published. Indeed, some of them are old and are up to new work, and the previous speaker was announcing already from the Commission that EFSA will be tasked to do some work on the upper levels. All the opinions are published, and we also developed an interactive tool for easy search for the different reference values. Under the Article 8 procedure that was introduced by the previous speaker, EFSA has also assessed the safety of a number of mainly botanicals, I would call them, starting from 2013 with the Yohin, and we have the most recent one, alpha-lipoic acid, that was adopted by the panel, and it's to be published within the next weeks. Safety and bioavailability of nutrient sources, that's also something that keeps us busy. And especially between 2005 and 2009, EFSA has produced a number of opinions and a comprehensive assessment of sources of vitamins and minerals in food supplements. And there is still a procedure in place. And for new products, an application has to be made to the European Commission. Then EFSA will assess, provide the scientific advice, and then Commission and Member States will decide on the inclusion or not of the respective nutrient source on the, in the Annex 2. Safety of novel foods. So under this regulation, we assess the safety of novel foods, everything what falls, or almost everything that falls under the definition of novel foods. And this is relevant for supplements because, as explained by a previous speaker, the food supplements are in the EU considered foods. So under the same rules when we talk about novel foods. But in addition, the regulation specifies that for those supplements where are vitamins and minerals and other substances already in use, have to go a safety assessment under the novel food regulation if there is a new production process applied or they contain or consist of engineered nanomaterials. So in those cases, all these product or ingredients will have to be assessed under the novel food regulation. And this is a centralized assessment by EFSA, by the way. Regarding safety of botanicals, we have quite some voluntary work done by EFSA because this is not bound to a specific sectorial regulation. So the Scientific Committee of EFSA has issued a guidance on safety, or guidance on how to assess botanicals. And this is very useful for the different panels when they have to look into the safety of specific product or botanical. Then the same Scientific Committee has developed a qualified presumption of safety approach that is very beneficial as well. And for quite some years, and is progressing the development, we have a compendium of botanicals. Again, it's not legal binding, not regulatory enforced. It's something that is available to everyone to be used. And in fact, this compendium, it's a database on botanicals that report naturally occur substances that might be of possible concern for the human health. And here you can find it. It's publicly available or as a web-based version on the internet. Efficacy assessment, very briefly, was mentioned also before. Under the Nutrition and Health Claims Regulation, we have assessed a huge number of claims, and we are still continuing at a much lower pace. So the process is still going on. Applicant may send application to a member state in this case. EFSA will assess the application and will produce an opinion. And finally, the European Commission and member states will decide on the authorization of the respective claim. In relation to, with regard to the outcome of this process over the years, we see a low rate of success. Only 11% of the claims were authorized. I'll not enter now into much of the detail. It's basically the lack of good data, weak dossier actually, in supporting the claims. We still have the botanicals claims on hold, and we'll see what will be the decision of the Commission and the member states, what will happen with them in the future. And this is, I think, my last slide. What we also produce, and it's part of our important, an important part of our activity, is to issue guidance documents. And we have a number of guidance documents produced, either cross-cutting guidance documents or sectorial guidance documents that you can find on our web. We have also specifically for the different sectors here under nutrition applications, regulations, and guidance documents for each of the sectors I was mentioning. You can find the regulations, but also linked to the regulations, but also the guidance documents. And in addition, we provide to the applicants a toolkit, then a catalog of services that where we interact with them and try to help as far as possible given our regulatory framework. And there is also the possibility to ask a question to EFSA in case of need for whatever information possible. So please, whoever interested, visit the site and you will find a wealth of information that might be relevant for you. And with this, I thank you very much for your attention.
Thank you, Mr. Courtois, for such an insightful presentation. We share all the information you provided to all the participants and guests. Moving on, we will share now three different associations presentations, namely FSE, EADSA, and AESGP.
Jabom, e muitos cumprimentos de Colonia, Alemania. And thank you for giving me the opportunity to address the conference briefly. My name is Peter Losen. I'm director of the Food Federation Germany and chair of Food Supplements Europe. Food Supplements Europe was founded 7 years ago to provide something that was vitally needed, a trade body that brought together national associations and large and small companies that reflect the wide diversity in this market. When we formed the organization, we recognized that one of our most important tasks would be to develop technical and regulatory guidance to support industry and governments in ensuring stringent application of the regulatory framework and good quality and safe products. I would encourage you all to take a look at our website to see the extensive library of documents that are intended to help companies, both members and non-members, to apply correctly the considerable body of European legislation applicable to food supplements, including novel foods, labeling, and the management of contaminants such as pyrrolizidine alkaloids and many others. We appreciate that the Food Supplements Directive will soon be 20 years old. And while it is clear that there are some challenges in the market, it is our view that the directive has worked very well indeed to bring clarity and consistency and reduce divergence between member states. And we are aware that there are areas that have been prioritized for further action, including maximum levels of vitamins and minerals. This is why we have commissioned a scientific update of the model for establishing maximum levels that we trust will be helpful in the coming discussions. As Food Supplements Europe, we believe that effective and uniform enforcement of the existing rules across the EU has to continue to be the top priority. The pandemic has revealed again that there are some operators that market products with medicinal claims and fraudulently position them as food supplements, mainly via the internet. They are not supplements, they are not medicines, they are simply illegal products. We therefore actively support any actions to take those products off the market. We are keen to provide any additional input and expertise to the Portuguese presidency on the topics that will be addressed today. Thank you very much and muito obrigado.
Was worth $160 billion, same size as the global OTC market. Good afternoon. EFSA is the global organization of the food supplement sector, a market which in 2020 was worth $116 billion. To give you a comparison, that's roughly the same size as the global OTC market. Helping build the regulatory frameworks for food supplements has been EADSA's primary activity. And this is not just about providing international best practices and experience, but ensuring that this fits with the culture of the countries. And we've seen a lot of progress outside the European Union over the years. In Asia, for example, just Southeast Asia, ASEAN, will this year complete their regulatory harmonization process. In China, we've seen the introduction of a notification system for health foods, food supplements. And in India, not only do we have a new regulatory system in place, but we've created with the government a resource center to support compliance, consumer education, and training across the country. Now, throughout all this work, the EU's Food Supplement Directive has been an important reference point for governments. Why? Primarily, it's about the definition. It's well crafted and captures the diverse nature of the ingredients which are used in food supplements, while also allowing adaptation for future evolution. The definition also helps ensure clear differentiation with other categories, particularly through its reference to small dosage forms. But many regulatory frameworks have some elements that are currently absent in the EU. Now, there's no time to go into all of these today, of course, but in our opinion, the most important is government GMP, good manufacturing practices. And most major markets, most major countries outside the EU have established specific GMP for supplements, from ASEAN to Australia to Korea to the US. And GMP has become really, and GMP mutual recognition have become a passport for international trade. Now, we developed a series of regulatory and technical tools for government, and these are available on our website and some on request, and we'd be very pleased to provide access to any authorities who would be interested to learn more. So lastly, thank you to the Portuguese presidency for this event and inviting us to this event, and we look forward to any future cooperation on the important topics of discussion. Thank you.
And thank you for giving ASGP the opportunity to share with you some of our key messages for the important discussion today. First of all, my name is Maud Perudin, and I'm the Deputy Director General of IASGP. IASGP is the voice of the European healthcare industry. We represent the manufacturers of food supplements, non-prescription medicines, and self-care medical devices. Why are we relevant to the discussion today? IASGP has been actively engaged on the food supplements topic since the adoption of the directive back in 2002. We are well-known stakeholders towards EFSA and the European Commission. Importantly, because we are the only organization with the three categories, and we are actively engaged in the three ecosystems of those three categories, we have a unique approach to the promotion of a balanced and consistent approach towards regulatory science, classification, risk management across the regulatory frameworks. Importantly for today, what we want to convey to you is that we actually call for stricter and more uniform enforcement of the existing rules applicable to food supplements to ensure consumer safety and fair competition. We very much welcome the prioritization of the work on the vitamins and minerals, and we actually look forward to contributing to this work in the coming years. Regarding the safety of plants and preparations, we actually believe that better characterization and quality specifications need to be ensured for the safety of the food supplements. Tools already exist in the legislation, both in the Article 8 procedures, as well as in the Novel Food Regulation. We would support in principle the negative approach and the ongoing initiative from the heads of food safety agencies and look forward to this work to be potentially shared at a later stage. We also call, and that's really an important part of our message, for a stronger enforcement of the nutrition and health claims regulation. This limbo situation related to the on-hold botanical claims has been having a huge and really significant negative impact on both food supplements, botanical-based or non-botanicals, as well as obviously on herbal medicines. And we call the authorities to stop this situation as soon as possible. We also call for more transparency and monitoring of the food supplements market. It's actually important to get a notification system, which would not be too burdensome on both the authorities and the operators, but give enforcement authorities the possibility to really get facilitation of the enforcement efficiency on the market, both online and in the brick and mortar market. Last and foremost, because for us, this is really important that in this debate on the legislative framework of food supplements, the question of the borderline and the classification issues of products is taken into account. In that context, IASGP advocates for more collaboration across the European regulatory landscape, because IASGP believes that there is space and relevance for the different categories of health products to coexist and compete fairly depending on what they contain, how they are presented, and how they act. There is no direct conflict between the existing legislative frameworks, and the main issue relates to the implementation of the harmonized definitions. In that context, there is a clear need for good collaboration and good classification guidance, including common criteria to be complied with by all the actors across the framework. Joint platforms gathering regulators by frameworks does not deliver as we have already perceived in other sectors. We need joint collaborative platforms across regulators in the various sectors and frameworks. On this, I would like to thank you again, and we look forward to pursuing this discussion in the near future. Thank you.
Dear guests, dear participants, now we will have a short break of 10 minutes and we will resume this conference at 15:50. Thank you. See you soon. Welcome back, dear participants. Now, before starting the second part of our conference, the roundtable, we ask you to join us on menti.com. We will provide you a code where you can answer to some question posed by the moderator of this roundtable. Now I welcome, for the roundtable on future perspectives, how to implement a harmonization of market entry food safety requirements for food supplements in the EU. We welcome Miss and Professor Maria do Céu Costa, Vice President of the Portuguese Society of Phytochemistry and Phytotherapy, a member of ESCOP Scientific Committee. Mrs. Costa is also a member of ASAE's Scientific Council and represents ASAE at the Emerging Risks Exchange Networks, ERN, of EFSA, European Food Safety Authority. She is also the inventor of 6 patents and author of 200 research publications. Ms. and Professor Costa, the floor is yours. Thank you.
Welcome to the roundtable. Good afternoon to all honorable participants, either sitting here in this room or attending online. We are starting the roundtable on future perspectives for food supplements. For someone from the academy like me, it is a privilege to have the task of moderating this roundtable between authorities and stakeholder representatives. Our goal is to collect contributions to the process of revision and harmonization of legislation regarding food supplements underway by the European Commission. As stated in the Commission staff working document published last May 2020, food we eat can affect our health in different ways, particularly by influencing the risk of developing any of non-communicable diseases such as cancer, cardiovascular disease, and obesity. Nutrition is one of the key elements in reaching the Sustainable Development Goals in health and the World Health Organization disease prevention targets, on both of which member states have subscribed to. Nutrition and health claims can play a role in dietary choices, and thus they could indirectly influence public health. The Nutrition and Health Claims Regulation, so-called Claims Regulation, was adopted in 2006 to ensure trustful information to consumers and the facilitation of the free movement of foods bearing claims. It harmonizes the use of claims in labeling, presentation and advertising of foods. It ensures that all claims in the EU are clear, accurate and based on scientific evidence. Thus, the scope of this roundtable is the same as the document from the working group of the European Commission, and that scope is to work on future perspectives on how to implement a harmonized market for the entry of food safety requirements for food supplements in the EU. And this objective has the same top issues identified by the Commission staff working document as being not harmonized yet. Which are those top issues? In its better regulation communication on 19th May 2014, the Commission announced the intention to carry out an evaluation of the claims regulation. This evaluation aims at assessing the impacts of 2 major issues in the context of the regulation. One is the nutrient profile nutrients, which are still not established at EU level, although Article 4 of the claims regulation envisaged their adoption on 19 January 2009. So there is a question linked to this issue of the nutrient profiles to be defined. And the question is it possible to predict that there are acceptable nutritional profiles, for instance, for medicinal plants as food safety ingredients? The second top issue, also identified by the Commission staff document, is that a long list of claims made on plants and their preparations is unregulated since 14 December 2012, when the list of permitted claims became applicable. A third issue arises from the absence of maximum safe limits for vitamins and minerals. And this third issue is also added to this roundtable. It has already been addressed in the two previous presentations today. So after introducing the goals of the roundtable, I will challenge all the participants to share with us the main constraints, lessons learned, and solutions for the top issues which were previously presented. In that way, I give the floor to Dominique de Clock from Belgium Ministry of Public Health to share with us your views on these subjects.
Dominique, the floor is yours.
Yes, thank you, Madam Chair. I will share my screen with my presentation. I hope you can see it correctly. So I will start. So good afternoon. First, I would like to thank the Portuguese Presidency for inviting me today and giving me the opportunity to share the experience of food supplements we have in Belgium. I will explain what is our national legal framework and how it has been designed. And I also will talk about our notification procedure, how we deal with borderline products, and some issues we have and we think that it can be solved. As there is no European harmonization, we drafted 3 specific royal decrees on food supplements. We have a royal decree regarding nutrients since 1992, translated the Food Supplement Directive and the regulation of chemical forms. This text is for food supplements and fortified foods. In 2017, we changed the maximum limits. They are based on toxicological limits, taking into account the jurisprudence of the European Court of Justice, and they are not recommended daily doses, in fact. To set the limits, we use the recommendation of our National Superior Health Council and other information like our National Food Consumption Survey to know the intakes. For information, you can see here for adults, the levels for vitamins, minerals, and some warnings that must be put on the label of the products. Due to some accidents, we also have drafted a royal decree on plants. The last modification is the conclusion of the Belfrit project. You can find there is a list in the royal decree for forbidden plants, a list for authorized mushrooms, and a list for authorized plants in food supplements and with conditions. The legislation on plants is based on the opinion of the Advisory Commission of Plants. This commission can give derogation for plants not listed in list 3 or for plants listed in list 1, so the forbidden ones. They also published monographs for some encapsulated essential oils and advice for some other plants. And thirdly, we have a royal decree on other substances like caffeine or monacolin K, and they are based on opinions of the Superior Health Council. On our website, operators and consumers can find the legislation and other useful regulations for food supplements like FIC regulation, the claims, and the novel food regulations. Then they also have information about the notification procedure. The notification is a possibility of the directive, and it has been made mandatory in Belgium by the 3 royal decrees. Since 2012, it can be done online. The companies have just to ask for an access and submit the files as explained in the user guide. The local administrators can grant access to other employees of the company or to consultants. I just want to show here what it looks like for a company. So this is the home page. It's user-friendly. And this is an example of a notification file. My unit is responsible for the notification process. We received around 8,000 files a year, and probably more this year. The composition and the labeling are checked, and remarks are made accordingly to Belgian and European regulations. At the end, we have 5 possibilities of conclusions. The notification number is attributed if there is no major non-conformity. The second possibility is that the notification number is not attributed because the file is incomplete. The notification number can be temporarily attributed where there are non-conformities or if there is some need for a derogation or further assessment. And finally, sometimes the notification is not applicable because the product doesn't fall under the food supplements or fortified food legislation. For the consumers and the companies, we have also a public search engine for declared food supplements. Products with major non-conformities have logos. To give you an idea, we have a huge database of more than 7,700 products declared in the last 30 years, but most of them are not more on the market. So we have decided that in 1 month, only notifications younger than 5 years will stay feasible. As indicated before, sometimes notifications are not applicable because the product don't fall under the food supplements legislation. One of those reasons is that the product falls under the pharmaceutical regulation. Then we, or a company, when we have a doubt about the status of the product, we can ask for the opinion of the mixed commission. This commission has members from ministries and agencies regarding medicinal products, medical devices, foodstuffs, cosmetic products, biocides, and consumption products. At the end, the applicant receives the conclusion if the product is a medicinal product or not, and what will be the action taken. This commission has published some guidelines and opinions to help the operators. And for example, we have information about N-acetylcysteine or melatonin. The last topic I was asked to talk about today is the current issue we have in food supplements and some solution we can think might help. So about the legal framework. We have some issue with the EU Frame Directive of food supplements because there are interpretation of some concepts like small quantities or concentrated sources. For example, if you have products like Bag Blossom, there are no concentrated sources, but they are available in small quantities. So are they food supplements or not? According to the definition. Due to the evolution of the market and the innovation, we are of the opinion that the directive must be updated or transferred into a regulation to have a better harmonization. Another point is the notification. The possibility is in the directive. It's a very useful tool for market surveillance and for operators. It will be more efficient if it's made mandatory and if all the notifications are checked and regularly updated. To ensure the safety of the ingredients, The Commission's initiative to set up the Task Force on Nutrients, which will allow EFSA to assign new mandates to determine upper levels and to establish harmonized maximum limits for vitamins and minerals, is very welcome. Specific maximum limits for food supplement could be set in the directive. We also are in favor of positive or negative lists of ingredients, as it has already been done by France, Italy, and Belgium to bring together the list of authorized plants. We welcome the new initiative of Germany and Ireland in the framework of the head of agencies to work on common lists of plants with a greater number of member states. And also to ensure safer products, Belgium is in the process of setting up a nutri-vigilance system. A European framework could be interesting, in particular to collect data from the EU as a whole. About borderline issues. We think in Belgium that we can minimize the problems, especially from medicines by presentation, if a solution can be found about on all claims. Personally, I also work in another sector, so other than food, and we have a working group for borderline products at the Commission, and we publish very useful guidelines, and it helps us and the operator to decide what kind of product it can be put on the market. And we think it will be very useful to have this kind of working group for food supplements. And finally, we could have a fair and competitive market with some targeted control. And during the pandemics, we can see that there is a lot of problems with e-commerce, so it's very important. All of these thoughts leads us to a need of harmonization in order to have safer products and fair competition. So thank you all. I would like to thank you for your attention, and if you have some questions, I will be pleased to answer. Thank you.
Thank you very much, Dominique de Clock, for your so comprehensive and nice presentation. We are delighted with your proposals and your identified issues seem very, very objective, especially the part of improving the definition, which could lead to many improvements indeed. And when it comes to making the notification mandatory, it looks good, although not simple notification, but accompanied by more information about the constituents, maybe. And of course, if there was a group of a classification of borderline products at the European level, one of your possible solutions, as far as we could understand, it would be also very, very good in order to achieve the desired harmonization. So I have one question for you, which is related to botanicals. Would you defend the Belgian list as the best proposal for a single list in the European market? Well, you can comment as you wish, of course.
I don't say that it's a better list, but it can be a base to have further work on it, because there are more plants than in the list. And we have worked a lot about this list, but the products evolve. We have more and more plants. So it's important to have a framework, some really good ideas what can be put on the market, because there are safety issues about some of the plants, and the consumption of the plants in food supplements are not the same as in common food, because it can be more concentrated, or it can be taken every day, and it's not the same exposure. So it's very important to have a list. I won't say that the Belgian one is better, but I think it's a very good base.
Sorry, I have no more questions now for the moment. Maybe later we'll come again to you. Thanks again for your presentation. And for the next participants, I will challenge to share with us the main constraints, lessons learned, and solutions envisaged in relation to these top issues of our roundtable. I would start with Portuguese General Directorate of Food and Veterinary under Ministry of Agriculture, here represented by Ana Paula Bico. I please have the floor.
Thank you for the presentation. First of all, yes, of course.
The first question will be, what are the three most important challenges facing the GAV as a competent authority for these days?
Thank you, Maria do Céu, for the question. First of all, I would like to congratulate ASAE for this conference about food supplements and greet all my colleagues of this panel, as well as all the participants in this conference. So, three challenges. First of all, for me, it's the high number of notifications presented to the GAV. We received around 7,000 of notifications for new products annually, and we must manage all the information. Just explain a little bit that our notification is mandatory for all the products, but the product can be placed on market in the same minute that the notification was sent to the GAV. The notification is not a pre-market authorization or an approval procedure. Also, according to general food law, the responsibility of ensuring that the product is compliant with the relevant food legislation lies with food business operator, as the other foodstuffs. When we check the notification, if a non-compliance is detected, we contact the food business operator. And also, if a question of food safety is an issue. And also, our notification process is free of charge. We know that some member states have the notification with a tax, and we don't have the tax for the notification. And this means that 40% of the notifications are from other member states that try to introduce the products in our market just for the mutual recognition. And related to notification, one issue, according to our official control, we must check 30% of these notifications. So we review 30% of the documents of the total notifications. Related to this, my second challenge is the lack of harmonization, because related to the ingredients and related to the labeling, namely related to the non-authorized claims. When we made the documentary check, we detected a high level of non-conformities regarding the composition of the products or the label, around 52% of the documentary checks made. We identify a high number of products with different botanical extracts whose historic of consumption is unknown or are not authorized novel food, or even that have pharmacological effects, and we contact the food business operator. We detect high levels or high levels of other substances than botanicals or vitamins and minerals, and which we have some concerns, such as catechins, L-carnitine, caffeine, monocholine K, and so on and so on. Related to the vitamins and minerals, we have two problems. In one end, we have the upper levels of vitamins and minerals and the composition of the products the upper level. When it exists or when we have some reference in the other member states' law. But we have also, at this time and nowadays, not allowed forms of vitamins and minerals in the food supplements. So this is an issue that have some problems. We have also, related to the composition, a big concern related to not an harmonized small quantity referred to be taken in food supplements. So we have a concern related to definition. We feel that is an important issue also the definition of concentrated sources of nutrients or other substances, because it's a concern with the medicines, the borderline products with medicines, or the food for sportsmen, or even with phytotherapeutic products or other medicine products. And we would like to have a good definition with a good regulation support and the maximum levels of vitamins, minerals, and other substances, and a list of positive substances that we can introduce in the food supplements. We have also an issue related to the status of food supplements for babies and young children. We have a legislation for foodstuffs intended to infants, children up 1 year old, and the food supplements are not in this list. Moreover, we don't have any additive allowed for infant and young children in food supplement formulation. So on the market, our opinion is that on market, it's not allowed to put food supplements for infants and young children. This is the problems related to the composition. Related to the labeling, we have some concerns, as all the European countries, related to the claims on old, the botanicals. The development of harmonized EU lists of botanicals and other substances would be needed to consider also information on the quality of the raw material and the substances, and the purity criteria of the substances, because we have some limits for the raw material in the foodstuffs. The same limits would be applied for the raw material for the substance. Have a list of purity criteria as we have for food additives. We would like to have EU harmonization of provisions on safe doses of plants, of course, but also on other substances that would be a support for improving the safety products and for addressing more clarity for the classification of the products. Another issue that we also feel that is an important issue is not related nor for the composition nor for the labeling, is the conclusion of our official control on spots visits of food business operators. Most of the operators in the sector come from the pharmaceutical industry, and they don't be aware about the rules for food industry. So we would like that the operators, maybe via these organizations or associations, can develop a good manufacturing practices code for implementing the ASAP and the food rules related to not only good manufacturing practice, but ASAP criteria on their plants. That codes for this sector should be aligned, of course, with the food regulation. And that would enhance consumer safety and by ensuring adequate uniform standards. And my third concern, or the third challenge for nowadays implementing food supplements regulation for us is mutual recognition. As we can see, due the lack of harmonization, we have different understandings along the EU. And the basic rule of the mutual recognition is that goods lawfully marketed in a member state can be freely placed on market on another member state without informing the authorities, except when prior authorization is required in a member state of destination. What this means? This can mean that the products can be put on place on our market, and due to the lack of harmonization, we can accept them if they invoke the mutual recognition. And we have lots of concerns related to that. And I don't know if we have any questions related to the first question.
Well, thank you very much. You provided a lot of information, very detailed information, and an important set of data concerning the challenge at the Portuguese authority. And you already referred something related with botanicals, and as an expert sitting in the EC claims group, do you have any information about what will happen to those botanical claims which are pending decision?
Okay. As we heard today for the last speakers, we don't have any information. We only have the evaluation made or published in 2020 related to the claims regulation, and the overall conclusion of the report is the evaluation findings show that the current situation, the objectives of the claims regulation are not fully attained. And this is the main conclusion of this report. In this report also, this report also asks some hypotheses related to to the traditional health medicine products, but some, if EFSA mimetizate the conditions for approval these claims, I don't know if it is possible, because we have the food regulation, and the food regulation states that the historic of consumption that is under the novel food regulation and is obey that this ingredient and this part of plant or this plant must be must as a historic of consumption before May of 1997. So for me is difficult to accept that one plant that is only used in food supplements in a small quantities could prove 30 years after that it has historic of consumption before 1997. We would like in this issue an allowed or not allowed list of botanical and its parts for use in food and considering the safety and historic of consumption.
Well, I think you provide. Thank you. You have provided a very comprehensive answer to the question, and at least we will be one of former experts to know about the progress of that working group, and maybe we can later have another question to you, but for the moment, and because we have been addressing botanicals, I know that there are already 2 questions from the audience for the roundtable participants. 2 of them will be for Valerio Curto, head of the nutrition unit of EFSA, and I would ask the organization to help me to show those questions. Please.
Thank you. We have some questions raised by the audience, but some of them were already answered by Valerio. We have 2 questions here on botanicals. It's a general question: why botanicals used in food supplements are still not harmonized? Of course, this subject was already mentioned before. Because it is really big problem with botanicals from, for example, Asia countries concerning their safety on history on as food in UAE. It's a question raised by the audience. I don't know if someone.
Sorry, Pedro, could you repeat the question?
Why botanicals used in food supplements are still not harmonized?
The botanicals are not harmonized because the historic of, more of them because the historic of consumption is not proved. So this is a rule that we, as in Europe, since 1997, and we haven't a consensus, and the food business operator didn't submit the dossier for each plant or each part of plant related to this.
The participant would like to comment on this issue. Maybe from INFARMED, the National Authority for Medicines, you would like some of the issues related with borderline products. Some of them may contain botanicals, others vitamins or whatever other substances. Could you please share with us any cases which you have considered in these last years, and some lessons learned and the solutions INFARMED proposed to solve those issues?
Can you give my presentation, please? Do you have my presentation? No?
I think there was a problem with the presentation, não há apresentação. Trouxe os seus apontamentos?
Não trouxe, mas pensei que tinham enviado.
Eu não sei. Não. Então, o leite agora...
Não, não problem.
Voltamos mais daqui um bocadinho ou avança, Dr. Faria Vaz?
Sim, sem slides. First of all, I have one presentation, but it's not here, so I'm going to give my presentation without slides. First of all, I would like to be grateful to the invitation that ASAE had made to Infarmed to be here. I would like to compliment the members of this roundtable, namely Professor Maria do Céu Costa and all the other members of this table. As you know, Infarmed, let me explain, is the national authority for medicines and health products, including medical devices and cosmetics. So we have many borderline issues concerning food supplements. In my presentation, I will focus the limitations identified by Infarmed concerning the food supplements, the initiatives that we have at the national level done, and finally, we would like to propose some improvements that we can make in the future and some final considerations and proposals. What are the limitations? Regarding the question of the borderline products between food supplements and medicines, there are several areas of concern, namely definition of maximum limits for vitamins and minerals, use of medicinal plants in food supplements, including unassessed health claims or negative opinions, use of other bioactive compounds, in particular active substances in medicines, in supplements, no proof of quality, being the quality of a product fundamental to also guarantee even not efficacy when we are talking about food supplements, at least safety. Notification of food supplements for babies and children up to 3 years old, a particularly vulnerable population group, should also be scrutinized. Use of medicinal plants in food supplements, including unassessed health claims or negative opinions. In this context, the European Commission should not agree with the requests of food business operators to directly transpose the concept of traditional use of medicinal plants for use in food supplements. Traditional use has always been aimed at treating or preventing diseases and their symptoms. Use of proprietary lists of medicinal plants that can be used in supplements by some countries, namely Belgium, France, and Italy, so-called Brieffield list, which in practice makes companies put supplements on the market avoiding demonstrating quality, safety, and efficacy as required for medicines. It should be stressed that traditional use of medicinal plants is only for the treatment and prevention of diseases. The heads of the agencies, of medicine agencies, do see a risk of circumvention of pharmaceutical registration procedures. No proof of quality, being the quality of a product fundamental to also guarantee even as I said before, even if not efficacy, at least safety. See the article on JAMA. The existence of many counterfeit products on the market, although they do not refer in their composition, include active substances used in medicines, namely food supplements intended for weight loss or improvement of sexual performance, suspected to contain substances with pharmacological activity that can only be used in medicines, such as phosphodiesterase type 5 inhibitor compounds, sildenafil, tadalafil, and others, as well obesity products that may include substances whose use in medicine has been banned due to risks associated with their use, which also puts consumers' health at risk. Initiatives at national level. At national, InfarMed's main goal is to ensure quality, safety, and efficacy of medicines and the quality, safety, and performance of health products in order to avoid the risks of their use while ensuring adequate standards of public health and consumers' protection. That's why the situations described with the above have been concerned in order to contribute to solve those problems. Several activities have been promoted, working together with other authorities. At the initiative of InfarMed, in August 2015, a working group called Working Group of Defining Boundaries Between Medicines and Food Supplements was created with representatives from various authorities involved, Portuguese authorities involved. InfarMed, the GAV, ASAE, and also from the Academy, which started work in January 2016 and worked about 1 year, and have held 8 meetings and published 5 guiding documents. The main objectives of the working group consisted in the discussion and agreement among the various authorities of classification rules that allow clear and uniform decisions to be taken in the scope of product classification, as well as the adoption of more general guiding rules in order to avoid repetition of work. This approach would also have the advantage of providing clear guidance to companies on the interpretation of various authorities and the advantage of preventing that some notification of products that may fall under the definition of illegal drugs are not detected. Concerning the initiatives at the national level, InfarMed established also a collaboration protocol with other authorities, namely with ASAE, with the Tax and Customs Authority. In 2004, 98 food supplements intended for weight loss or improvement of sexual performance suspected of containing substance with pharmacological activity that can only be used in medicines were collected. After analysis carried out by the InfarMed laboratory, 27 supplements were identified as containing substance with pharmacological activity. The results of this laboratory data were posted on the InfarMed website. What can be improved? The working group that we have told before, it's a good experience, and we propose that in the future we can discuss these issues in a working group with various authorities, national authorities. The Infarmed considers that the issuing of opinions on the classification of borderline products should be considered in a substance classification advisory committee made up of experts from the various authorities and by experts in several areas, namely those mentioned above, with powers to draw up scientific opinions on borderline products, which would allow the level of consumer protection to be greatly improved by promoting various objectives with this working group. Thank you very much.
Thank you. You have provided a very exhaustive set of data too, with some details concerning borderline products. And my conclusion is that you agree at the end that creation of a working group at EU level for the preparation of guidelines on borderline products would help the harmonization of this problem, would provide the solution for the problem and help the harmonization of the decisions on borderline products. Do you agree on that after your conclusion? That's what I
yes, of course, at the national level, and that's also at European level. So we can handle both working groups, but we need also to have this working group there, at the national level, because we have some particular issues that we must handle at the national level.
Maybe we revisit that subject later, and I will give the floor to later on to APAR's representative to maybe later, please, if you don't mind, in order to comment the issue of no proof of quality and other issues we would find important to explain with your views. But for the moment, I would like to address the Economic and Food Safety Authority of Portugal and the Ministry of Economy and Digital Transition in the person of Filipa Vasconcelos. And we know that ASAE is a national authority that acts as police and law enforcement body, and you have an inspective role. So you deal with risk assessment, risk communication, risk management in the field of food supplements too. The initiative of this conference was yours. And thus I take this opportunity to publicly congratulate you for the initiative. And so I have the big question for you. What is the motivation for having organized this conference?
Well, thank you very much, Professor Maria do Céu. I don't want to spend a lot of time because we must move to the Menticom to interact with all the audience. And as you already said, we have a very wide, broad scope of intervention. And what we want and intend with this food supplements conference, it was join all the chain of the food supplements to exchange opinions, and that's why we invite the European Commission, the EFSA, and we bring all the representatives, European federations and associations regarding the representative of members on the food supplements. And it's very important because we want a truly and global discussion about this issue. It's very important about the complexity and the multiplicity of models for market eating in the community, and from the notification process until the end of the chain with the official controls done in this sector. So bearing in mind the importance of public health importance, the protection of the consumer interests, the fair competition among the operators, economic operators, we establish a working program for this semester in particular, taking the opportunity of the Portuguese presidency in this semester, and we want to put this topic of food supplements in all different fora that ASAE take place. And we host in Lisbon, chaired by our General Inspector, Mr. Gaspar, the last meeting of the heads of food safety agencies here in Lisbon, and we put this topic on the agenda. We invite our colleagues from Ireland to make the photographic, the framework about the food supplements in Europe. We also joined to the working party on foodstuffs of the presidency of the council, and we put food supplements on the agenda, and all the member states are discussing the problem. And for this, firstly, we join in Portugal all the ministries involved, and I think that it's very important to stress this, because in the same table we have the Ministry of Agriculture with DGAV, that it's the competent authority on the food supplements. We join the Ministry of Health with Infarmed, and also with the Health Directorate General, and of course, ASAE under the Ministry of Economy and Digital Transition. So, for this, we want to have the conciliation of all the interests, and I would like to share also that in preparation of this work program under the presidency, we request for the European Economic and Social Committee an exploratory opinion on the topic harmonizing entry in the EU food supplement market, best practice and solutions, whose contribution is expected very shortly, and together with the conclusions of this opinion exploratory about this important issue, and with the conclusions of this food supplements conference, we would like to address some like a progress report about the food supplements in Europe. And I just want to add, if you allowed me, because we already talked here about the risk perception, and I think that's why we have one first question on the Mentimeter, and we ask to the people, to all the participants, to put your mobile on the end, to try it, and to launch, we will launch the first question, because the risk perception is key, and perhaps I will come back to this topic, because the times run and we must move on. But just to finish this intervention, I would like to underline also that according to the last available annual reporting of RASF, the Rapid Alerting Food and Feed System, in a total of more than 4,000 notifications in 2019, of which 1,175 were alerts, and we can see that food supplements are already in the top 3 as the type of product most notified. So food supplements are in the topic on the top 3, and it's very important to have this in mind because we just have an alert when any situation pose a risk to consumers. So it is just a small remark. So I think that you want to move to the Mentimeter, and I think that it's a very good idea. Please, thank you.
Thank you very much. Congratulations again for the initiative, and let's go to the menti.com.
Okay.
So the first question is, when you prescribe, purchase or consume food supplement, do you consider that are highly safe and controlled foods, are foods with some safety problems, are foods with many safety problems and high risk, are foods with a similar risk as medicines, or are natural foods with a lower risk than medicines, are foods with a higher risk than medicines? Please give your answer at menti.com, inserting the code. So they are equivalent, natural foods and but now they are changing, coming more answers for other responses. Responders are increasing, and winning at the moment there is a perception that food supplements are highly safe and controlled foods, followed by the perception that they are natural foods with a lower risk than medicines, and also are foods with some safety problems. So there are a division from the respondents in relation to being natural foods with a lower risk than medicines, or foods with some safety problems. It is increasing the view that there are foods with some safety problems. It's reaching the view that they are highly safe and controlled foods. So now we have equal number of responses. In relation to food supplements, with the view that is increasing now that there are foods with some safety problems in relation, so it is increasing 21 in relation to 19 answering that they are highly safe and controlled foods. It seems it did not stop yet. So
yes, we already have 72 participants voting, 75.
Yeah,
you could see on the below on the right side.
So increasing the number of participants, giving their views. In relation to the question, when you prescribe purchase of consume food supplement, do you consider that? And the answer has to be selected between 1, 2, 3, 4, 5, 6 possibilities. Now winning that they are foods with some safety problems, but winning for 3 in relation to they are highly safe and controlled foods, now increasing both of them. And now we have 90 respondents, 26 saying that they are highly safe and controlled foods, and 28 answering they are foods with some safety problems. Now increasing that they are safe, increasing that they have some safety problems. And the lower number of respondents say that they are foods with a similar risk as medicines, only 5 in figures. So 32 winning, having the risk perception that they are foods with some safety problems. And second position for 28 respondents with the perception that they are highly safe and controlled foods. Okay. Maybe we can go to the next question, please.
Could you put the second, please?
at menti.com with code. Second question. Regarding the constraints in the food supplement sector from regulatory and safety view, what is your level of agreement with the following statements? And we have 1, 2, 3, 4, 5, 6, 7, 8 statements with which are being answered. We don't have figures yet.
Yes, the code to enter, it's 12754348.
Thanks. Again, the question regarding the constraints in the food supplement sector from regulatory and safety view, what is your level of agreement with following statements? And may I read the statements? There is no prior approval procedure, and it is not guaranteed that is carried out a pre-market check to all products. Second statement, as only a small part of ingredients is harmonized, it is not possible to carry out an European conformity check. Third statement, misuse and overuse of the mutual recognition principle, which doesn't guarantee the protection and safety of consumers. Fourth statement, only vitamins and minerals, including food supplement, are regulated and without maximum limits. Then the following statement, a large part of consumers confuse food supplements with medicines in terms of effects and characteristics. Next one, unfair competition among operators with the European market due to different approaches by each member state. The existence of food supplement on the market with same substances present in medicines with no clear limits in the legislation for their inclusion. And the last statement, which could be chosen, is possible problems regarding drug interactions and surveillance of adverse effects. So we have to select according to your view if you strongly disagree or you strongly agree. At the moment, the higher number of respondents have selected preferentially the first statement, which states that there is no prior approval procedure and it is not guaranteed that is carried out a pre-market check to all products. It is being quite equal to the statement which says a large part of consumers confuse food supplements with medicines in terms of effects and characteristics. So I would say that almost all of them are quite comparable. Well, at the moment, 1, 2, 3, 4, 7 are very comparable because the score is about 3.7, 3.8, 3.6. So the lower adhesion statement is that at the moment, of course, is that only vitamins and minerals, including food supplements, are regulated and without maximum limits, which scores for 2.9. The others are around 3.6, 3.7 is the higher score level at the moment for the first statement. There is no prior approval procedure and it is not guaranteed that is carried out a pre-market check to all products. Yes, I would like, and it is also a suggestion from Filipa Vasconcelos, that Pedro Lobo Duval, here representing APARD, a member of EHPM, could give your view about all the issues which are discussed at the moment, and also a comment on this, please.
Okay. It's a pleasure for me be here. It's an honor. I am president of APAR. My name is Pedro Lobo Duval, like you say, doctor. The Portuguese Food Association, founded in 1986, represents 90% of national companies in market, distribute, imported and manufacture food supplements. Our mission is to promote benefits, quality and safety food supplements to consumers and ensure compliance with fundamental European standards as the free movement of food supplements. We integrate EHPM, European Federation of Associations of Health Food Product Manufacturers, European reference organization for the sector. We work towards developing an appropriate regulatory framework throughout the European Union for our members' products and to promote industry best practices for products quality and safety. Our market. Portugal, like Europe, is a growing market for food supplements. More and more Portuguese consumers are concerned about their health and see food supplements as complement of their diet and as a way to ensure maintain their well-being. In 2006, ASAE carried out a study to ASAE at the national level with a sample of 1,200 individuals in order to study the food supplements market. The study concluded that 81% of the individuals are already consume or currently consume food supplements. The study also refers that more than 72% has intention to buy food supplements again, which is an indicator of consumer satisfaction and reconnection of benefits of food supplements. Our main relevant topics, the main relevant topics for us are mainly three: the mutual recognition, the botanical claims, botanical list, and something about probiotics to make an example, but of course, both are harmonization. Mutual recognition is a rule, not an exception. The essence of the European Union is the free movement of goods and people in a single market. Consequences of no implementation in Portugal as follows. An economic operator cannot enter a market with the same product that is already marked in another European Union member state, because sometimes authorities classify as food supplements as medicine on the basis of its active ingredients, doses, or substance profile. Refuse food supplement notifications even there is no risk for the public health. And they are lack sometimes of understanding of the mutual recognition. Consequences for the Portuguese companies and consumers. Unfair competition between European Union economic operators. Portuguese consumers can buy other food supplements legally marketed in other member states over the internet. In 2017, there are problems in Portugal with arginine, glucosamine, and bromine. The authorities classify food supplements with this substance as medicine on basis of their active ingredients, doses, or substance profile, and request the economic operators to withdraw all products from the market. Products have been sold in Portugal as food supplements for many years without any reported side effects. APAR contest the situation and the rules were withdrawn. Understanding that the substance of mutual recognitions reduces barriers to free movement of products, simplifies administrative procedures for both companies and national authorities, and provides the same opportunity to all European companies. Of course, they are borderline products. Borderline exists. And the way to classify a borderline product is on a case-by-case basis, taking into account many other factors. In Portugal, they are vitamins, minerals, and botanics that are classified as both. APAR do not accept all products that have been legally on the market as food supplements in Portugal for many years and also in other member states are considered medicines only because they include substances that can also classify as medicine. This will create a different level of legal protection for food supplement business manufacturing in different European Union member states. The consumers will continue to buy on the internet food supplements products legally marked in the other member states that are considered be medicine in the other countries. Harmonisation must be done by the European institutions, avoiding national legislation that will impose more differences in the European Union. I have an example, the term of probiotics. For me, the term of probiotics is the name of a group of microorganisms. This is no harmonized. A regulatory approach allowing the use of thermoprobiotic in UE, European Union. The thermoprobiotic is not allowed in Portugal and is considered an health claim. However, all consumers know and use this term, everybody. We believe that the use of the thermoprobiotic should be permitted in the European Union. This will create a labeling environment that consumers can trust and will allow consumers to inform choices about the products they buy and consume. For example, Italy, Spain and Netherlands allows the use of thermoprobiotics on the products. It's urgent for the European institutions to reach the common positions, to give all European companies the same business opportunity and allow all European consumers to make informed choices. Botanicals. In Portugal, food supplements with at least one botanical represent 71% of the food supplements market. Botanicals are not harmonized by any European law. Portugal doesn't have a positive list, but APAR advises its members to use welfare list since it is a useful tool for harmonizations of botanicals in food supplements. In Portugal, luckily, the notification process for food supplements includes the main botanicals list from other member states. Botanicals claim. Botanicals claims are very important for consumers and for the food supplement sector. The botanicals claims have been pending since 2012, 9 years. And because of that, the needs of industry and consumers are not being met. Foods and food supplements are being placed on the market without appropriate indications for use. Research and developing are being inhibited. Consumers are not receiving information on foods that they buy. Consumers are turning to uncontrolled sources for information, like internet. Internet, they have good things and bad things, like you know. It's urgent to have a different approach and recognition of the tradition of use of botanicals. EHPM has developed a proposal with great claims that can give to the consumer clear information about the health effects of food supplements. EHPM, on this site, everybody can consult, have a diagram, it is a pyramid, and they have 3 grades. Grade C is general empirical experience. Like everybody knows, valerian, passion flower is for nervous systems, cranberry for urinary systems, and so. There are lots of traditions in plants in Europe. The grade B, it with studies, mechanical studies, chemical studies, observational studies. And grade A, the maximum, with human experiments, the scientific evidence. This is, I think, it's very important because we need health claims for the public be informed. And in conclusion, quality and the responsibility of manufacturing. We want safety, efficacy and equality. Safe, of course. I cannot agree with Dr. António Faria Vaz when he says that proof of quality is not true. Why? Because if they are on food supplements, they are not on food. ASAE make a survey, go to the shops, they make analysis, and also the products, the majority of them in Portugal are made in laboratories that made medicine, and they are supervised by Infarmed. And also, these products are selling a lot in pharmacies. They are supervised from Infarmed. Of course, there are frauds everywhere. There are Dieselgate, there are horse meat scandal, there are medicine scandals, food supplement scandals, there are. But if, like Dr. António Faria Vaz say, 27 problems with products that, food supplement that Infarmed analyze. Engineer Ana Paula Bico says that every year are 7,000 notifications. Is a lot, 27, but I think it's not a big number for all the food stuff that we have in Portugal. To final, we want the same equality. We want upper levels on the minerals and vitamins, but safe upper levels. Now low doses only are safe. Many Europeans view food supplements as products which improve health and wellness. And increasing numbers of health professionals in Europe are started implementing an integrated approach to their practice and are progressively recommending food supplements to their patients to prevent health challenges and for overall health and wellness. Thank you very much, and I vote for harmonization.
Thank you very much for your presentation. You entered in depth in all top issues we defined for this roundtable. Of course, you also raised some questions in relation to some examples like valerian. Valerian, as far as I am informed, as I know, has been traditionally used as medicine because it has a pharmacological action, and so it has not nutrient profile defined. I think we could discuss several hours on these examples, if you go into detail, but I have to be brief in my intervention, so I would like at first to ask Valerio Curto if he is on it, because he is the head of the nutrition unit of EFSA. Why EFSA has not provided yet the scientific opinion on cause-effect relationship of the botanicals, why we are waiting for so long for the claims, solutions, claims which are pending, why they are not authorized.
If you allowed me, Professor, just to underline that we have the official data from the European Commission about RASF, and it's not an opinion, it's a fact that the food supplements are in the third number of the products notified in 2019. And comparing with 2018, this number are increasing and increase around 2%, just for note this. And I think that we already talk about the constraints, but we are here all together around this table to perspective the solutions. And I suggest to go to the Mentimeter, the third question, please.
Want to address the question, or may I go ahead? So, regarding possible solutions to improve the food supplement sector, from regulatory and safety view, what is your level of agreement with following options? And you have 1, 2, 3, 4, 5, 6, 7, 8 hypotheses. So, you have to enter the code 37579313 at www.menti.com. We are waiting. Yes, I will read the alternative hypothesis you have for answering to this question. So first one, inclusion of a priori approval procedure, including mandatory and sufficient data on safety of the ingredients used. Second, create a single entry in a European portal, centralizing all notifications and using a single application procedure, harmonized approach. At the moment, 1, 2, 3, 4 are winning, and one of them is that the one just read, promote a greater alertness of the part of the health professionals involved to possible adverse reactions by food supplements, doctors, pharmacists, nutritionists, creation of a working group led by EFSA is another one to share information between member states and to establish assessment procedures. The next one is to promote the monitoring of undesirable effects at EU level. The next one, establishment of a positive list of ingredients and substances, including plants to be used in food supplements with their maximum permitted use quantities. Then the other one is education programs, health campaigns to reduce food supplements usage or to promote a prudent use. And last one, which is not winning, but almost winning, is revision and update of food supplement definition to harmonize product characteristics and to take into account existing innovation. So at the moment, winning with the score 4.2 is establishment of a positive list of ingredients and substances, including plants to be used in food supplements with their maximum permitted use quantities. It's ex aequo with promote the monitoring of undesirable effects at EU level. Yes. So the lower number of answers, so the lower score is for education programs, health campaigns to reduce food supplement usage or to promote a prudent use. At the moment, we have 84 respondents, 85. So maybe I can link with the question which arose from audience at the chat, and he's for Dr. António Faria Vaz. It's for you, a question we have in chat. So the question is, I will read as it is. To António, why the medicine agency Infarmed assumes that the quality of a food supplement is not satisfactory if it fully complies with food legislation, which is of course not as detailed in respect of safety and quality as the medicine legislation. Maybe I would also invite, after you, Gav by Ana Paula Bico to comment too, if you wish. Please.
Thank you very much. I would say that we are taking into account the level of evidence that medicines will have concerning quality, efficacy, and safety. And what concerns food supplements, I used a public article published in the Journal of American Medical Association in 2013 that says in this title, I would present a slide, but I haven't taken it, and the title say something like, how can we know if supplements are safe if we don't know what is them? This is an article published on May 27, 2003 in JAMA. So what we are saying, and we have gave some examples of collection of the activities of Infarmed with other authorities, with some products that have medicine products in its composition, food supplements, probably counterfeit. But let me say, we don't need to discuss our difference of opinion, but what we would like is to have, to guarantee to people that all the food supplements and medicines have quality and are safety. So let me explain what I haven't said before, in what we understand for what we are proposing for the working group on borderline issues. We propose the following objectives: a comprehensive and uniform regulatory framework ensuring coherence, transparency, and avoiding the adoption of different strategies for product classification, which led to confusion and possible dangerous inequalities. Preventing and combating adulteration of food supplements with medicines and unauthorized substances. Improving the provision of information to consumers on food supplements to ensure their safe use. Ensuring that health claims on the labeling of food supplements are based on sound and independent scientific evidence and that are not misleading. Thank you.
Well, I would address maybe a quite final question because we are near the end of this roundtable. Aren't we in agreement that an harmonization at the EU level would be a best solution for all these differences and all these contrasts which were identified in the market, including some quality issues if there are. In that sense, I would ask Ana Paula Bico for a comment on how do you think the European legislation can be an obstacle on one way for the harmonization and on the other way, driving force for innovation to go ahead to solve these constraints and to have a real good market for public health consumers, of course, for operators and their business. Please comment.
Thank you, Professor. First of all, the EU safety rules are one of the most strict rules among the world. So, in this context, the risk assessment takes time, and the innovative foodstuffs must have risk assessment. This is a step that we cannot jump, and we cannot left out the requires, and this requires time and costs, of course. Toxicological tests, exposure studies, scientific evidences. The time, we know very well, the time in the perspective of food business operator are different than the ones of the regulators and the risk assessment. However, this time could be reduced or more efficiently spent if the food business operators knows the rules or the provisions in order to prepare correctly the dossiers and evaluates early in the time the development process of the innovative products. In our views, the need for specific authorization process that have to be complied, such as according to novel food regulation, such as on health claims. Secondly, it has already been recognized that it is not coherent to have harmonized rules on health claims, while the use of plants in foods is governed by national rules. It is a consensus. Due to time, I only made a comment that is, in the last 27th of March, entry in the enforce the regulation 2019-3081 that amends the 178 regulation, and we strongly believe that the transparency regulation, that is this regulation 1381, can mitigate or aims mitigate some of the concerns about innovation. I don't know if I answered your question. If you want more details about this or this transparency regulation, I can answer.
Well, I think you have addressed the main aspects of the problem of the question. And would you like to add any comment, please?
Yes, please. Thank you very much, Professor. Just to stress what Ana Paula Bico has mentioned, that it's really important to underline that this transparency regulation, it's a great revolution because allow to all the industry to have access to the risk assessment studies and in an open data base of EFSA and in an open data spirit of the European Commission. So it's very important to underline this new transparency and sustainability regulation. And this regulation also changed the model of governance of EFSA, the European Food Safety Authority. Just to stress that it is very important. And this regulation also established a plan related with risk communication. And we have the problem already talked here in this roundtable about the risk perception. And because the risk perception is not the same by the consumers, even by the prescriptors, and which are the effects. And it's true that already mentioned Dr. Pedro Lobo Duval that in 27 in the 1,000 of food supplements, we don't want to demonize the food supplements. The food supplements are foods, but to be food must be safe. It's a statement, it's not an opinion. And the risk communication, it's based to mitigate the below perception of the risk of the consumers of the prescriptions. Thank you.
Oh, sorry, of course, safe is the more important thing. But we cannot compare food supplements with medicine. Medicine has side effects, like we know. Here, food supplements, we want no contaminations, that is through the label, of course, and they are laws. Of course, you want that operators are under the law, of course. It's not, we want safety, of course.
Okay, just a last remark, but we must understand that in food supplements, as well in the medicines, we have some problems with the complexification of the elements that could below the action of the effect of the food supplement, isn't it, Professor? We have a problem related with the increase of resistance, the resistance of micro antibiotics related with this issue. In our scientific council, in the last opinion, the members point out this problem. Perhaps you, Professor, could clarify this issue. Thank you.
Well, that is a kind of challenge. We are at the ending of the conference. Anyway, thanks for the comment. I would just add to what you have referred. Of course, there are interactions, there are all problems which are so-called safety potential issues, which we rely on EFSA opinions to make a judgment of the cause-effect relationship and the safety of the ingredients of food supplements. So I think that after saying that, we would like to end this roundtable having a contribution from each member of the roundtable for the conclusions. And I will start with that part. So, yeah, so it's just a short sentence or keyword for the conclusions of this roundtable.
Okay, like I say in conclusion of my intervention, we want safety, of course, efficacy and equality. We want that the operator in Portugal has the same situation that in another country, and the consumers the same. We want harmonization. And for us, food supplements are safe. Of course, there are frauds everywhere. Thank you very much.
DGAV, or DGAV in Portuguese, please. Your contribution.
Food safety and innovative products are welcomed in the food supplement sectors. According to EU rules, harmonized rules, so upper levels of vitamins, minerals, and other substances.
Sub-Inspector of ASAE.
Food safety for the consumers, fair competition among operators, and harmonization, of course.
What we in FarmEd would consider that the transparency and safer products for human use will be our aim, our common aim for all. We need to be transparent and also to inform all citizens about the products they are using in a transparency way and based on the best evidence. Thank you.
Thank you.
Sorry, and of course, public health.
May I add my contribution? Well, I would say a keyword, harmonization, which is in agreement with your proposals. And I would ask for the Commission staff working document to be considered for a quick solution for the top issues there identified, which were the main objective of the discussion in this roundtable. So, harmonization between all the member states in EU and solution for the top issues here identified. Thank you very much to all participants.
Thank you, Professor. Just to announce the last question, to ask all the participants what, in one word, please put, Reggie, put the question on the screen, if you please. In one word, what is in menti.com 464999006.
Dear participants, now for closing the roundtable, we will have the conclusions by Professor Costa.
The keyword well-being, which appeared as answer to this fourth question, is a main conclusion for this roundtable. And indeed, that well-being, according to all the contributions, shall arrive with safety, efficacy, quality, fair competition, innovation, transparency, and we can finish now this roundtable. And I thank all the participants and all the audience. And as I border for taking this initiative, then I finally to end my participation, I would like to present this issue, which is at the homepage of ASAE, or ASAE, Riscos e Alimentos, and is dedicated to food supplements. And it's already online, yes.
And you could download and see it to the mag in the chat. You have the path. Thank you very much.
Dear participants, now for the closing remarks, please welcome the Honourable Minister of Agriculture, Ms. Maria do Céu Antunes.
Muito obrigada.
Thank you. Good afternoon to everyone. You cannot imagine how interesting it was for me to be here and assist to this part of your work. I want to compliment the Secretary of State of Defense of the Consumer and thank all the Economic Ministry and the Portuguese Presidency for organizing this seminar, high-level seminar, on such an important topic. I would like to tell you all, namely those that here represent the health sector in Farmed, economy, with the representatives of ASAE and the president that it's behind, agriculture, namely the General Director of the TGAF, but also to thank the association that represents the producers of the supplements. So I want to say that I'm very satisfied that here I am today with you as Agriculture Minister, as a member of the government that now is the President of the Council of the European Union, but also as a citizen that pays attention to the consumption, but also as biochemical, because that's my training with extra training on food safety. So I'm really very satisfied in order to understand the dimension of this technical work done at the highest level. And we could do it not only at national level, but mainly at EU level. So I want to really be very happy with all that. And I greet not only those that are here present in the room, but all those that were presented and participated online, namely the European Authority for Food Safety, but also the DG Santé of the European Commission. I want to greet everyone and congratulate for the pertinence of this debate on food supplements, having into account that it is a sector that is growing more and more, not only because we all understand that there is a new trend, a new consumption trend, but also because there's an increase in the life expectancy, so it means that these food supplements are more used in the diets of our days. So having into account that it is a very dynamic sector where we have daily innovation all the time, presenting very big challenges, but also great opportunities so that we all can give an answer to the needs that are represented by the consumers' choices, namely in what concerns lifestyle, and want to complement their diets. I see in the last slide, it was excellent, great to have that question asked to everyone. Things like trust, transparency, facts based on science, in technology, in order to minimize the risks that are associated, but at the same time they promote the health and well-being. This is what we are speaking about when we get together in the same table agriculture, industry, and economy. So I'm very pleased to be with you in these conclusions. I also would like to speak about an important, essential theme and topic for the Portuguese presidency in this semester. Not because we are starting, but because we're following this. We want to give special importance to these three great priorities for Europe. In first, First of all, because we are living in a very advanced crisis that is here. It's with us because of the COVID-19 that shows all our fragilities, but calls upon us in order to promote a European recovery, leveraging the challenges of the digital transition, but also in what concerns a climate change and environmental change and transition. And with this transition, or with these two transitions, we have to get to everyone, so we need to have a social pillar very well defined in order not to leave anyone behind. But it is also important that we are able to reinforce a strategic domain that is related with the autonomy of this continent. Europe wants to be open to the world, and then for the agriculture, we have 4 great priorities based mainly in the guidelines for a more green Europe and a more resilient Europe. And I'm speaking in this first phase about a great priority, which is to adapt the common agricultural policy, making it more modern and agreeing with these values of the society. Then the rural development. We have an agriculture that is a lot based in the fight against the abandon of the more rural territories with more sustainable practices. We also have then the innovation, and that's the reason why here in Portugal we developed an innovation agenda, and we believe that the digital transition, it is essential in order to give an answer to these challenges that we have in front of us, and the food safety. Because we all have to have the perception that in order to ensure the food safety, the health and the well-being of the citizens, we need also to have this in the agriculture, the animal well-being, the vegetable sanity and the agri-food. So the topic that we are discussing here today is in agreement with the themes that we have in our presidency in more global terms as well as in agricultural ones. And we want, or we believe that this opportunity, because maybe all crises bring opportunities to do more and better, so we are all called upon in order to reinforce the structural system, the agri-food system in Europe, that are the brand image of the European model, increasing the levels of information and transparency that will contribute to feed more and more the trust of the consumers. And this way, we think that the strategy from farm to food, it is essential in order to attain other domains in what concerns the food safety, the animal health and well-being, and the vegetable sanity. So we are committed in order to create better conditions that will allow the consumers to make choices that are more and more aware of the food they choose and they consume. In Portugal, people say that we are what we eat, and that's true, and the people knows it's. So we need to look at the food system, and we need to look at the informed choices of the consumer as essential factor for that. And that's why it is also important to have the supplement food sector. And we have to be able to work together like what happened today in this round table, because we need to build an holistic approach, an interdisciplinary approach. So it is essential to have a control that is more and more efficient, based on a risk evaluation that is robust and very transparent. Here has been also mentioned, so that the products that come to the market, they fulfill all the safety requirements that are demanded. These products, in order to have their importance in the market, they should not lower the demanding levels. And we've heard that already. So that's the necessity to harmonize. It is very important to have a more stabilized definition of these border products, so-called border products, and it is essential to do that. So we think that this conference is of great importance because it gets together different actors. We see different approaches in a common topic, but the idea is to help the sector to build a more robust future and a future that has an economic opportunity to develop itself. So we need an harmonized legislation, more harmonized. We need to increase the trust in the food safety system in the European Union, and all that will help to keep the strong reputation and strong quality of our products. If that will be, the European continent would not be the biggest exporter of products. If that will be so, we would not have still the preference of the consumers in the external market during this pandemic. And well, I'm not going to say that we are in a protective way, but we should value in a conscious and aware way our products. I also want to say that we should not forget the role of the citizens, of the consumers. We want to have a society that is more aware that its own choices will promote its own health and well-being, ensuring that the responsible consumption and fulfilling a balanced diet, that we want to be more and more balanced, diversified and sustainable. So that will help us to diminish the asymmetries, and that will better use our natural resources, that will preserve biodiversity and will fight the waste, and that we can, like that, build truly a fair society in line with the sustainable development goals that we all as society are committed to. And namely, I have the 3 goals that are what I just said. The goal 2, hunger and sustainable agriculture. Number 3, health and well-being. And the goal 12, consumption and sustainable production. We are aware that this reflection that we had this afternoon in this conference is going to help a lot to focus on what is the public policy in each one of the member states, but to focus on an harmony that we want to happen between all the member states in the EU, so that we can also have more fair ways to commercialize the products, namely of the products that we still import, so that they will be following the same principles that we want the European producers to develop. Thank you, everyone. We in the agriculture are really committed. The government is committed. The Portuguese presidency is committed. We are working together in order to get to this point. It's of everyone, this ambition. Thank you.
Dear participants and dear distinguished guests, ASAE and the Portuguese Presidency of the EU Council thanks you all for participating in this high-level conference on food supplements, and we hope to shape the future of this area. Thank you all, and see you soon.